between foreigners or expatriates and local. They're all cared for, and they're all given all the needed care that is available in the Salmania Medical Complex.
Yes.
The great effort that was done was not only by Ministry of Health itself, but other ministries were involved. Civil Defense Ministry of Interior activated its services in extremely good way, and the BDF hospital cooperated with Ministry of Health in extremely generous and efficient way. King Hamad Hospital has received around 23 of our patients in a very rapid sequence by sending their ambulances to Salmania Medical Complex to care for these patients. And therefore, the integrated work that was done was really idealistic.
Yes. Yes.
And it was good, and therefore the community has received extremely good care. And Salmania Medical Complex Emergency Department is back to its normal function currently. And the patients who are admitted are looked after and are followed. And the complexity of the care requires that they have to have multidisciplinary care, from surgery, burn surgery, orthopedics, and medical care for those who are admitted. And this is the nature of the practice that we have in Salmania, in which we look after our community and we sympathize with them and we care for them so that they can go back to their work and get healthy as soon as possible.
Yes, yes. Doctor, the injured that have received treatment or are receiving treatment at Salmania Complex, as well as other hospitals right now, we've heard a lot of them are undergoing probably some surgeries and so on. Can you tell us about the medical team that has been assembled in order to treat these patients?
Yes, there is a medical trauma team which screens the patients and see what is and prioritizes the care. And then there are the specialty cares who look after them. We have 2 patients in Salmania who required neurosurgical attention, and one of them required surgery. And then we have burn surgeons who looked after their burn cases and take care of them. All this happened in late last evening, early morning today, and morning today. Then there is the orthopedic group of surgeons who look after these fractures, and they care for them, and they admit them to the orthopedic ward when they're stable. We also have a step-down unit for the ICU, in which when the patients are stable, they are moved to the step-down unit. And currently, 2 patients have been moved to the step-down unit because they are stable in a relatively good condition. All of the patients are in relatively stable conditions currently.
Yes.
And most of them are in good health, and I hope by coming next week they will be discharged. Well, there are only 3 cases who are in intensive care and they are severely injured, and they need this kind of care for a longer period of time.
Yes, yes. Doctor, my final question, please bear with us. Can you tell us more about the cooperation with the different embassies to assure about their nationals that are in the hospital?
Yes. When the patients come, all the patients are identified by the system that we have. Many of the patients who came to us were not speaking Arabic or English, and we had translators there to speak to us about where do they belong. We had patients mostly from Bangladesh. One of them was from India and one from Pakistan, and a couple of Bahraini patients. And therefore, all the concerned people who are related to these patients were notified about these cases and these patients, and also the places that they work, they were notified about them. We have 2 cases that were not identified initially who they are because of the severe illness and condition that we couldn't. And then we asked for assistance from Ministry of Interior to identify them by the pictures that we have, and they were identified, and currently all the expatriates, all their next of kin were notified about them. So in that way, all our patients are cared for, and the relatives came to Salmania to visit them, or their friends came to Salmania and visited them today.
Perfect. Very good. Thank you very much, Dr. Mohammed Al-Awali, for answering our questions. and a speedy recovery, hopefully, for the injured. Civil defense personnel continue their efforts in the site of the collapse that took place yesterday in a two-floor building due to a leak in one of the gas cylinders led to an explosion. The civil defense personnel are ensuring the safety of all surrounding buildings and vehicles that were damaged by the collapse. Public Security Chief Major General Tariq bin Hassan Al Hassan valued the follow-up of His Royal Highness the Prime Minister and his directives to investigate the causes of the incident and submitting a report in this regard to His Royal Highness. He also commended the directives and follow-up of the Minister of Interior. Major General Tariq Al Hassan had visited yesterday evening the scene of the incident and closely followed the efforts exerted by all bodies, especially the civil defense, to control the situation and ensure speed of rescuing the injured and transporting them to the hospitals, as well as the exhumation of the dead. The Ministry of Interior carried out its operations through the use of thermal cameras and sniffer dogs in the search and rescue. The main operations room received an alert at 7:20 p.m. on Tuesday evening. The patrols managed to reach the site within 3 minutes and began to set up a police cordon around the site and organize traffic on the nearby streets. Upon the arrival of the rescue teams, the civil defense began immediately to remove the debris and use drones and police dogs to identify the locations of the buried people. It also classified the situations of the injured and evacuated them to the hospital. The Chief of Public Security said that the public prosecution was informed of the incident, stressing the responsibility of the owners of residential buildings to provide public safety requirements, thus protecting the lives of residents. He also expressed thanks and appreciation to all the authorities and ministries that helped in dealing with the incident. He valued the efforts of the civil defense personnel, which included 11 civil defense vehicles, 15 security patrols, 60 officers and 19 ambulances. 24 injured were evacuated to the hospital. The General Directorate of Civil Defense again urged citizens and residents to comply with public safety requirements regarding gas connections in order to ensure the security and safety of all. The civil defense personnel are continuing their efforts at the site of the building which collapsed yesterday due to a leak in one of the gas cylinders, which led to an explosion in Salmania area. The civil defense personnel are ensuring the safety of all surrounding buildings and vehicles that were damaged by the collapse. The final death toll was 4, while a number of patients are still receiving treatment in hospitals and their injuries range from mild to severe. For more information on this pressing issue, we are joined by the Head of Planning and Development Division of the General Directorate of Civil Defense, Lieutenant Colonel Mohammed Al Bin Ghadir. Hello, Lieutenant Colonel Mohammed. Thank you very much for being with us. It seems we have a technical problem. We'll try to get him back.